In this lecture, we're going to review the anatomy of the respiratory system, and we'll begin with an overview of the major structures, and we'll then follow through with the upper portions of the respiratory system. And so when we think about the respiratory organs, this system is composed of a number of different structures that functions to move air from the environment into the body and from the body back into the environment. And from an anatomical perspective, the respiratory organs consist of what's called the upper respiratory tract, and this is composed of the nose, the nasal cavity, the sinuses, as well as the pharynx. And we'll take a look at these in a little bit more detail, and we'll point these out here on the right hand side in a moment. The lower respiratory tract includes the trachea, the bronchi, and the smaller branches of the air passageways. And so we can think about this entire system as a duct that will functions to ventilate the lungs with external air, and then to move the air in the lungs back into the environment. And the respiratory system consists of two general zones. The first zone is referred to as the conducting zone. And just as the term suggests, the conducting zone transports air to the sites of gas exchange. And so when we talk about gas exchange, we're referring to individual molecules. And that takes place in what's called the respiratory zone. And the respiratory zone is the area located very deep inside the lungs. And this is the terminal portion of airflow. And at that portion, we have molecular oxygen and carbon dioxide exchange between the respiratory system and the cardiovascular system. So just taking a look at some of these major structures here, airflow begins here through the nasal cavity as well as through the oral cavity, and that air will move through into the pharynx, and then through the posterior region of the oral cavity, which is continuous with the pharynx. Then it will move down into the larynx on the anterior side of the esophagus, and that air will flow through the main, what's often referred to as the windpipe, the trachea, which then branches into the right lung and the left lung, and forms many more branches that we just referred to as bronchi. One last point I want to highlight here on this diagram that's not highlighted with the blue is the diaphragm muscle. And the diaphragm muscle is the major inspiratory muscle. So when this muscle contracts, it's going to create a vacuum in the lungs, and that will pull air from the environment into the oral and nasal cavities, and will pull that air down into the lungs. So specifically, when we take a look at the first entry into the respiratory system, we're just going to focus on the nose here in this case. The function of the nose is to provide, just as we indicated, an airway for respiration. So it provides that ventilation aspect. Now, when air enters the nose, that air is humidified, which is what moisten refers to. In other words, H2O molecules are added to that air, giving that sense of humidification. And because that air is flowing past the tissues of the nose, which is held at approximately core body temperature, that air will also increase in temperature, as well as as heat will flow from a higher temperature to a lower temperature to transfer that heat. Cilia within the nasal cavities will also filter and clean the inspired air, and will also serve as a resonating chamber for speech. And the nasal cavities are also also has connections to the nervous system, and olfactory receptors are sensory receptors buried into the tissues that line the nasal cavity that are particularly sensitive to various chemicals locate up in that air that is inspired, and so that provides people with the sense of smell. The external nares are just simply referred to as the nostrils, and the internal nasal cavity is divided by what's called a nasal septum, and the nasal cavity is continuous with the what's called the nasopharynx, as we'll see on the next slide pointed out. Note that we have these ridges located towards the posterior side of the nasal cavity called choanae, and the choanae uh, functions to capture various particulates. These are elements in the inspired air that do not contribute to physiological function. And so this is where it acts, in a sense, as a filter. This posterior region, the choanae, are also rich in various glands, as well as having a very rich blood supply. When we continue to move that air further posterior in the nasal cavity, that will then start to move inferior, we move into the pharynx, and there are three components to the pharynx. And the pharynx is a funnel-shaped passageway, and you can see this illustrated with this very large cavern of the nasal cavity that begins to narrow into the nasopharynx, and this connects the nasal cavity with the oral cavity that you can see located just in this region on the right hand side of the slide. So the nasopharynx, to summarize, is posterior to the nasal cavity. That is continuous with the oropharynx. It's just that these regions are continuous, but do have different names associated with those. And this second bullet item here is of the oropharynx is located posterior to the oral cavity, and both will eventually merge into the laryngopharynx, which is posterior to the larynx and is continuous with the larynx as well, and the esophagus. And the esophagus is located on the posterior side of the trachea, which is the major passageway of air into the lungs. And so we see once again here the funnel-shaped nasopharynx continuous from the nasal cavity that is continuous with the oropharynx, eventually merging into the laryngopharynx. Taking a closer look at the larynx, this is sitting inferior to the pharynx. The larynx is the region that is continuous with the trachea, and the function here is to route air and food into the proper channels. The proper channels being that air moves inferior through the trachea, and food will move inferior along into the esophagus, which will move into the stomach. And the larynx also plays a very important role in voice production. The larynx is characterized by various cartilages, and the cartilage functions to provide that structure and support to this major region that is responsible for routing air and food into their respective channels. So this cartilage includes hyaline cartilage, with the exception of the epiglottis, which I'll point out here shortly. And the thyroid cartilage has a very prominent distinction or prominence here, the laryngeal prominence, also referred to as the Adam's apple, on the anterior side. A very important structure here is the epiglottis, and the epiglottis is made up of elastic cartilage, so it is somewhat flexible, and its job is to cover the larynx during swallowing. So when we swallow food, that food is intended to move through the posterior esophagus, but we don't want that food moving into the trachea. So the epiglottis will move inferior and close off the trachea as we swallow that food. And that's illustrated right here on the right hand side. So here you see this elastic cartilage that when we attempt to swallow food, this epiglottis will move in an inferior manner and completely obstruct movement into the trachea so that the food will be routed into the posterior direction. The vestibular fold is connective tissue that is referred to as the false vocal cord. And this is not a regular contributor to sound, except in certain types of sounds. So low types of growling types of sounds are enhanced by the action of the false vocal cord, but the true vocal cord, as you can see here, is primarily responsible for generating the various sounds that people make during speech. What we see here, the three main types of cartilage that we find is the cricoid cartilage, and this is just a cross section of it. And the cricoid cartilage completely encircles the trachea. So the trachea is where we are moving into right now as that air continues to flow, and this is the main windpipe, if you will, of the respiratory system. On the anterior side, we see the thyroid cartilage with its major prominence, often referred to as the Adam's apple, and located throughout the trachea, or through as we move inferior, are rings of tracheal cartilage. And the tracheal cartilage functions as a stabilizing and structural element that prevents the trachea from collapsing. So this ends this first video on the anatomy of the respiratory system.